how fitting we are in this incredible room dedicated in the memory of my uncles and my late father, talking about the mission of social justice that occupied their legislative careers.
Thanks to Patrick, we are confronting the challenges and opportunities in this new frontier of mental health and addiction with strength and with clarity.
In a world which is so dark for so many people because of addiction and mental health issues, Patrick Kennedy is a beacon of light.
Mental health parity is essential to ensuring that illness in the brain is treated like illness anywhere else in the body.
The repeal of the Affordable Care Act represents a great danger, but we have an opportunity to really focus anew on health equity, and especially mental health equity.
So if Congress wants to make good on its shared commitment to mental health reform, we have an awful lot more work to do. We need to preserve and expand the Affordable Care Act, not repeal it. We need our insurance companies to comply with existing federal parity laws.
We want to launch this parityregistry.org, which is going to be a state-by-state report card so we can keep and evaluate how states are doing against the goal of parity for all, because the new frontier is breaking the shame that we have as individuals who suffer from these illnesses and saying we're not going to allow ourselves to be stigmatized. We're no longer going to allow ourselves to have a separate and unequal system of care because they carve out mental health and they don't reimburse it the same as they do other physical care. Insurance companies may not like what I'm saying, but frankly, they know also that mental health is the force multiplier for reducing overall health care costs.
We had hundreds of consumer complaints regarding health plan denials of coverage. So the evidence provided from these investigations gave us the ability to make major settlements. We've returned millions of dollars to consumers as restitution when health plans illegally denied them coverage. But most important, these settlements achieved key reforms in the administration of behavioral health benefits in our state. Plans are now covering residential mental health and drug treatment and have revised their medical management practices. As a result of our settlements, more consumers are able to access coverage for mental health and addiction treatment. I have been a family in crisis. I have been on the front line battling for equality for treatment, for parity, for my family. So this, for your visual reference, is a copy of my appeal to OPM. Fortunately, I had learned of the Kennedy Forum, and this Parity Resource Guide, which you can see is tabbed to death, was my Bible during that battle. It gave me the tools and the resources and the lingo that I needed, because it was not something that, as an average American, if you're not in that field, you don't understand the lingo that they're using. But thanks to having that as a weapon that I was able to use for the battle, on March 22nd, 2016, 7 months after the initial denial, OPM overturned denial, and Humana was forced to reimburse me for a portion of that care.
I am the proud mom of 2 sons who are remarkable and resilient young men who also have suffered from mental illness and substance abuse for the last 6 years. But my hope is that I can prevent other families from suffering the financial, the physical, and emotional toll that my family has.
They are kicking down the doors of the shame and stigma that comes with these brain illnesses because of our understanding of what they're going through. And now they can kick down the doors of denial.
This is a cause worth pursuing. It's a cause worth believing in. We have a divided America, and I'm sorry about that, but we must unite on this issue. The obligation of all of us is to help those individuals who cannot help themselves.
Treatment, not tragedy. That ought to be the theme. God bless all of you.
We need, as a community, to celebrate the courage, the honesty, and the persistence that it takes to stay with recovery.
Today, the message is we're living in denial. And if you think about it, you cannot honestly say, with the escalating suicide rates and the escalating overdose rates, at a time when every other illness is going down, that we have a crisis.
When you consider the fact that only 1 in 10 people with a substance use disorder gets treatment, that is unacceptable. Because if you imagine if only 1 in 10 people with diabetes or cancer could get treatment. Would we stand for that? And these prevention and treatment programs don't just work to help address people's illness, but they actually help save money. We have prevention programs that save up to $64 for every $1 invested. On the one hand, some people say we don't have money to keep investing in substance use and addiction. And I say we can't afford not to.
These are diseases that they are going to carry all of their lives. So why not prevent them?
And if we come together to address addiction as the public health crisis that it is, then we will be able to strengthen communities, rebuild families, and ultimately save lives.
Because when you, your colleagues, your patients raise your voices, people in Washington listen.
You can count on me, and you can count on a lot of us. And as Winston Churchill once said, don't ever, 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 ever give up.
Every day in America, tornadoes of addiction are ripping through American lives, leaving families destroyed and desperate for help. And who's there? We have to be there to answer that call. Thanks so much for coming.